What should I ask my trauma therapist about re-traumatization? When you start talking about your past trauma, it's natural to worry about re-traumatization. Asking your therapist the right questions can help you feel safer and more in control during treatment. First, ask how they define re-traumatization and what signs you should look for. This might include feeling overwhelmed, having flashbacks, panic attacks, or emotional distress that feels unmanageable. Knowing these signs helps you recognize if therapy is becoming too intense. Next, inquire about the steps they take to prevent re-traumatization. Good trauma-informed care involves respecting your boundaries, avoiding language or approaches that could trigger you, and making sure you feel in charge of your healing process. It's also helpful to ask how they handle situations if you do feel re-traumatized during or after a session. A supportive therapist will have strategies ready, like grounding techniques or pausing treatment to help you regain calm. Understanding how they balance exploring difficult memories with keeping you emotionally safe is important too. Therapists should carefully navigate trauma work so it doesn't overwhelm you. Ask about common triggers for re-traumatization, such as certain questions, physical touch, or emotional confrontations, and how you can communicate your limits clearly. It's vital that your therapist is aware of systemic factors like rigid rules or insensitive behaviors that could unintentionally cause harm. Make sure to ask how they incorporate your feedback about feeling safe or unsafe during sessions. A collaborative approach makes a big difference. If re-traumatization happens, find out what additional resources or supports they can offer, like referrals to specialists or coping skills training. If you have other issues like anxiety or substance use, ask how they work with those co-occurring conditions to reduce the risk of re-traumatization. Lastly, ask what signs your loved ones or support network should watch for outside of therapy. Educating those close to you can help them support your healing and avoid triggering situations. Remember, re-traumatization can cause symptoms like nightmares, flashbacks, intense anxiety, or feelings of shame. It can be triggered by therapy methods, environment, or interpersonal dynamics that resemble past trauma. Trauma-informed care focuses on creating a safe, trusting, and empowering space. Open communication about your boundaries, triggers, and feelings is key to preventing and managing re-traumatization. Always discuss your concerns with your therapist and work together to find the safest path forward for your healing journey.